And it's a big
Okay.
procedure, you know, it'll take, for me to do 2,000 grafts for the beard from the back of your head, it'll probably take more than a day, actually. Probably have to bring
Mm.
you back for another half day. So a full day and then another half day to
Right.
get it done. So it's a big undertaking, you know, multiple assistants are needed
Right.
for a procedure like this. So you know, some people, I don't know, like there's a lot of misconceptions with hair transplants, but one thing that definitely is not is very fast. You know, it's a slow process. And then even once the surgery is done, you still have to wait almost a year for the hair to fully grow out. Usually
Oh.
at 4 to 6 months, you can start to see some hair, and then it kind
Mm-hmm.
of grows from there.
Mm.
So that's the idea behind it. It's not very painful. We give you medications during the procedure to make you comfortable, and then
Right.
there's a lot of numbing, you know, numbing injections for the
Right.
procedure. So,
Okay.
but you're not going to be like fully out. You know, it's done under what's called oral sedation. So it's just like Valium and Ambien. So things that you can
Okay.
take as a pill, not like a, you know, injection into the vein or anything like that.
Right. 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 Okay.